Today, I would like to discuss a topic that affects countless individuals and families around the world: addiction and concept of few terms related to it like triggers, relapse, craving, and some more. You are thinking why I am discussing about these terms. Well, the answer: if you do not understand the true meaning of these terms, then it will be difficult to prevent yourself to become an addict or to recover from addiction. Trigger refers to something that can prompt or stimulate a person to engage in substance abuse or addictive behavior. Triggers are often associated with specific situations, emotions, or environmental cues that make an individual more vulnerable to cravings and relapse. Here's a more detailed explanation. Number 1. Internal triggers. These are emotional or psychological factors that can lead to cravings or a desire to use a substance. They might include feelings of stress, anxiety, depression, loneliness, or even positive emotions like excitement. Internal triggers are often tied to the individual's emotional state or thought patterns. Number 2. External triggers. External triggers are related to environmental cues or situations that are associated with substance use. For example, being in a place where the person used to use the substance, seeing people they used to use with, or encountering specific objects or smells associated with the substance can act as external triggers. Number 3. Situational triggers. Certain situations or events can act as triggers. For instance, a person in addiction recovery attending a party where alcohol or drugs are present might be triggered to use.
Number 4. Social triggers. Interactions with specific individuals, especially those who encourage or engage in substance use, can be powerful triggers for someone struggling with addiction. Now, as we explained you about trigger, let us move to the next part. What is craving? Craving refers to a strong and often overwhelming desire or urge to use a substance or engage in addictive behavior. These cravings can be intense and difficult to control, and they are a hallmark symptom of addiction. Cravings are typically driven by a combination of physical, psychological, and environmental factors, and they can be triggered by a variety of stimuli, including stress, exposure to substances, certain situations, or even the sight or smell of something associated with the addiction. Understanding and managing cravings is a critical aspect of addiction recovery. People in recovery often work on strategies to cope with cravings, which may include seeking support from therapists, counselors, or support groups, as well as developing healthier ways to manage stress, emotions, and triggers that lead to these intense desires to use substances over time. With effective treatment and support, cravings can become less frequent and less intense, contributing to long-term recovery from addiction.
Here are a few more important points to consider about cravings in addiction. Number 1. Intensity and duration. Cravings can vary in intensity and duration. Some cravings may be fleeting and relatively mild, while others can be extremely powerful and long-lasting. The intensity and duration of cravings can be influenced by factors such as the type of substance, the individual's history of use, and their current emotional state. Number 2. Physical and psychological aspects. Cravings have both physical and psychological components. Physically, they can manifest as uncomfortable sensations like restlessness, sweating, or a racing heart. Psychologically, cravings are accompanied by obsessive thoughts about the substance and a powerful desire to use it. Now, the third term is relapse. Relapse refers to the return to substance use or engaging in addictive behaviors after a period of abstinence or recovery. It represents a setback in the individual's efforts to overcome addiction. Relapse can take various forms, from a one-time lapse to a full-blown return to a pattern of compulsive substance use. Here are some key points to understand about relapse in addiction. Number 1. Lapse versus relapse. Lapse is a single episode of substance use after a period of abstinence. It can be a one-time event and doesn't necessarily lead to a full relapse. However, if the person does not intervene and return to abstinence, a lapse can turn into a relapse, which involves a more sustained return to addictive behaviors.
Number 2, multifactorial. Relapse is a complex phenomenon and can be triggered by various factors. We already discussed about the factors related to trigger a few minutes back. Number 3, warning signs. There are often warning signs or stages leading up to a relapse. These may include increased cravings, romanticizing past substance use, social withdrawal, and neglecting recovery-related activities. We should understand that relapse is not a failure until and unless it's deliberate. Addiction is a complex condition that affects both the brain and behavior. Individuals dealing with addiction face a tremendous challenge, and relapse can be part of their journey. It's essential to view relapse as an opportunity to learn and grow. By identifying the triggers and factors that led to the relapse, individuals can strengthen their recovery plans and prevent future setbacks. Along with this 3 factors, trigger, craving, and relapse, there are few other factors also which we all must know about. One of the factor is coping mechanism. Coping mechanisms, often referred to as coping strategies or coping skills, are techniques and behaviors that individuals use to deal with the challenges, stressors, and triggers they encounter during their recovery journey. These mechanisms are designed to help individuals manage cravings, avoid relapse, and maintain their sobriety. Coping mechanisms can be essential tools for individuals seeking to overcome addiction.
Here are some common examples. Number 1. Healthy distractions, engaging in activities that divert one's attention away from cravings or triggers. This can include hobbies, exercise, reading, or other interests. Number 2. Mindfulness and meditation, practices that help individuals stay in the present moment, reduce stress, and become more aware of their thoughts and feelings. These techniques can be valuable for managing stress and cravings. Number 3. Support groups, participating in support groups like Alcoholics Anonymous, AA, or Narcotics Anonymous, NA, provides a sense of community, where individuals can share experiences, gain insight, and receive encouragement from others in recovery. Number 4. Therapy and counseling. Working with a therapist or counselor can help individuals address the underlying emotional and psychological issues that may have contributed to their addiction. It provides a safe space to explore these issues and develop healthier coping strategies. Number 5. Self-care, taking care of one's physical and emotional well-being, including getting enough sleep, eating nutritious foods, and practicing self-compassion. Self-care is essential for managing stress and preventing relapse.
Number 6. Communication. Open and honest communication with loved ones, friends, or support networks can provide emotional support and help individuals express their feelings and challenges. Number 7. Crisis planning. Developing a plan for dealing with high-risk situations, such as identifying a trusted friend to call in times of need or having a list of crisis helplines. Number 8. Positive affirmations. Using positive self-talk and affirmations to boost self-esteem and motivation. Replacing negative thoughts with positive ones can be a powerful tool in maintaining recovery. Number 9. Avoiding triggers. Learning to recognize and avoid situations, people, or environments that trigger cravings. This can involve making changes in one's daily routine or lifestyle. Number 10. Pharmacological support. In some cases, medical treatments or medications prescribed by healthcare professionals can help individuals manage cravings and withdrawal symptoms, making it easier to abstain from substances. By identifying and addressing triggers, relapse and craving, you can provide better support to yourself while struggling with addiction. It's a battle, but with the right support and understanding, recovery is possible. In our upcoming videos, we will explain how to prevent relapse, craving, and trigger with more details, and even we will explain each and every step of coping mechanism in details. We will come up with more topics also. I hope you like this video. Subscribe for more information. Together, we can help individuals break free from the chains of addiction and build a healthier, more fulfilling life. Thank you.